there are growing calls for people with a disability and their supporters to have a choice over which COVID vaccine they receive. The Delta variant of the virus is a massive threat to the disability community as advocacy organisations plead for the risks to be assessed. Joining me live now is Linda Reynolds. She is the Minister for the National Disability Insurance Scheme. Thank you so much for your time. First of all, last week we learned that there were 5 people living in a disability home that contracted the Delta variant in New South Wales, and they were all unvaccinated. Do you know why?
Well, that's actually not correct, Laura. So the situation is this, we do have 4 participants, but they had in one home and they all had received their first injection the week before, in fact, and so they are still at home in the residence and they haven't been hospitalised. Another 4 of the workers also had been vaccinated and did have tested positive, but my understanding is that they are okay at the moment. We have had one other NDIS participant who did become positive in Lakemba in respite care, but unfortunately nobody in that home had been vaccinated. So we're just waiting today to see whether any others have become positive. So there is no question, it was a slow start to the rollout of disability vaccinations. It was really underestimated, the complexity, but things are now going very well. So of the most vulnerable who are in what we call Category 1A, who are in some form of disability accommodation or homes, 60% have now had their first vaccination and 75% in residential aged care. So we are picking up the numbers very fast. And I'd like to, if I could, just give a shout out to the disability providers who have been absolutely magnificent in working with us to get residents and also to get workers vaccinated.
So what are we talking about as a percentage? How many are fully vaccinated?
Of those 60%, nearly half are now fully vaccinated. This week alone in New South Wales, we've got 130 homes being visited for first and second vaccinations. So, of course, given the current situation, we are focusing efforts in Sydney and in particularly in the impacted LGAs. So, slow start, but things are picking up rapidly.
Okay, we're looking at payments as well this morning. How bad does it need to get in New South Wales before the federal government starts to plug those gaps in support?
Well, the agreement with the National Cabinet and with the New South Wales Government is that the federal government is responsible for doing the income support payments, of which we are doing, I think, very well. Just to give you an idea, over the last month now, we've made over 750,000 payments to people in New South Wales. And in total, we've made nearly $450 million worth of payments. The difference between JobKeeper, and I think this is a very positive difference, is that this is going straight to families. So there's no delay. People go online. As soon as their claim is granted, they get the payment at the latest overnight. So we are getting money to people when they most need it.
Yeah, that's great. And the quantum is big, but 100,000 people are on youth allowance in New South Wales alone, for example. How long are they expected to get by with no job, no prospect of getting any more income at the moment, and some living on just a couple of $100 a week?
Well, I think you're referring to the fact that those who are already receiving income support from the federal government are not eligible for the COVID-19 disaster payments, and that's for a very good reason. That's because they are already getting income support from the federal government. And if they do lose hours, there is an automatic stabiliser within the security net within the system so that their next payment will be increased up to the maximum. So this payment for anybody wasn't designed to fully replace people's lost income, but it is designed to be quick, to be generous, and also to make sure that people can feed their families.
So the reports this morning that the government is considering more support isn't true?
Well, the government continuously looks at the evolving situation, and we have continually evolved the payment processes and the supports that we provide to evolve now with the Delta variant and the requirements for these type of lockdowns. So we are meeting almost daily at the moment and having a look at assessing what is actually required. So we'll keep evolving with the virus.
Well, Linda Reynolds, before I let you go, there's been an article published today from Biopharma Dispatch, not exactly a well-known publication. It doesn't have a byline on it, but it details very close in detail the frustration on what officials did around the vaccine rollout. Companies warned Greg Hunt that there would be no vaccine queue to join, and there was not quick action needed from the government. Do heads need to roll here? Should someone in the department be sacked?
Look, absolutely not. I have been involved in this, the vaccine rollout from the very beginning, and can I tell you, there was no handbook. Every nation has done their rollout differently. Vaccines were developed very quickly. They were tested very quickly. We made decisions early on to wait till the vaccines had been sufficiently tested before we put them in Australian arms. We didn't expect the AstraZeneca decision from ATAGI that we did get. So, look, we have dealt with everything that has come our way. I think the Prime Minister has been and continues to be an outstanding leader in these issues. So we face and we tackle the issues as they arrive and we make decisions. So we've got well over 11 million jabs in people's arms as of today. We're doing 1 million jabs a week.
Yeah.
We've got 1 million Pfizers coming in. The pharmacies are rolling out. All federal Commonwealth residential aged care facilities have had both doses. So we are picking up the pace, and we're now actually looking in and getting doses for boosters for next year.
Yeah.
So we've dealt with things as they've come along, and things are now very much on track and speeding up.
Well, yeah, probably needs to be a little bit faster, but we will leave it there. Linda Reynolds, as always, appreciate your time.
1 million doses a week and climbing, and there are thousands of ways now that people can get vaccinated. And I just finish on encouraging everybody in Australia to look at how you can get vaccinated, to talk to your GP, go to your local pharmacy now, see if they're giving the vaccinations, and get vaccinated.